1 month ago, I was totally in distress. Feed is not coming, baby is not latching, I am not having enough on pumping also. What am I going to give this baby? This baby is going to be very sickly baby, because even the fact that we are doctors, we are taught the mechanism of how it works, but the practical aspect of it, like doing a breastfeeding, that is not there. And my husband as a pediatrician could just guide me, okay, aise pakdo, aise karo, aise try karo, but to make me do it physically was not possible for him. I'm Dr. Meera and I am from Jamshedpur, Jharkhand, better known as Tatanagar. By profession, I'm an anesthetist and this is my second baby. She was born on 20th of December 2024. I had a lot of problems having the baby because of the gap, because of my age. I conceived with a lot of difficulty. There were 2-3 miscarriages before I conceived this baby. Then the first trimester was riddled with loads of complications. And by the time I reached 36 weeks, I was on the brink of a breakdown that please get this baby out. I cannot take anymore. So she was delivered preterm. My husband is a newborn specialist. He's a neonatologist. He's a pediatrician. He was dead against it, but still I forced for a preterm delivery. And a late preterm has its own set of complications, one of which is being breathing difficulty. And she actually landed with that. And that is why she had to go to the nursery. So when 5 days the baby has taken formula, 3 days, 4 days in the nursery where the sister is every 2 hourly time, he just doesn't want to latch to you. He's least interested. When I'm getting it easily, why would I, want to go and suckle at the mother's breast and take? So that is why when she came to me, I knew that I was in trouble and I needed help. Even the fact that we are doctors, we are, taught the mechanism of how it works, but the practical aspect of it, like doing a breastfeeding, that is not there. And even my husband as a pediatrician could just guide me, okay, aise pakdo, aise karo, aise try karo, but make me do it physically was not possible for him because he has never done it, he has never seen it. But then the problem is that till the baby doesn't suckle, the feed is not sufficient that you can express it also, because the hormone mechanism doesn't get triggered. So till she doesn't latch, I was getting very scanty, like 20-30 ml. 20-30 ml to feed her, the taste is also very different. When the baby came back, she was almost 80% on formula. My husband was like, don't let the baby cry. She's already had difficulty breathing problems. I don't want her to scream her lungs out and be even more sick. So the moment she would cry, he would stand with a bottle, fill up. And I used to think, yeah, when I'm not even getting a chance, how will I feed this baby? Where will the milk come from? Kya karungi? That was my mentality. Then I looked for a lactation expert in the city. There is nobody in the city who could guide me. I called up all the gynecologists. I am an anesthetist, so I have at least 12 gynecologists whom I could ask. I asked everybody and everybody said, क्या करना है? वही simple है. क्या जरूरत है? क्या है lactation counselor? ये सब बड़े शहर के चोचले. I said, no, ma'am, it's not बड़े शहर के चोचले. It's a practical this thing. Nobody wants to discuss it. I think doctor moms struggle much more than general moms. When I was scrolling through Facebook repeatedly, Babynama kept coming up. So I said, okay, fine, let me attend one webinar. The first time that I attended your webinar, there was 80% formula, barely 10% feed, not latching at all, or latching was like she was not holding on properly. She was holding on to the nipple. She was just not cooperating with me. So I was in total stress. I think after 2 or 3 consults, I was pretty, happy with the way she started latching. Even ma'am was watching. She said, okay, now she's doing better. She now latches fairly well. If she's hungry, she'll stay on one side for about 15 to 20 minutes. So we are 90% breastfeed and less than 10% formula feed, almost 80-90% direct feed, and a little bit of bottle when she's, sleeping. I feel very much relieved because 1 month ago, I was totally in distress. Feed is not coming. Baby is not latching. I'm not having enough on pumping also. What am I going to give this baby? This baby is going to be very sickly baby. Today, baby is doing well. She's feeding well. She's gaining her weight really well. She puts on 120 to 150 grams every week. I would like to, tell other mothers that please don't feel sad or disheartened if you're asking for help, because there's nothing wrong in asking for help. Everybody needs help. And if you get help at the right time, you will be in a much more better situation than if you ask help at a very late situation. People can't help you.